Gastroesophageal reflux disease, also known as GERD, it's a chronic GI disorder characterized by regurgitation of stomach contents into the esophagus, one of the most commonly diagnosed digestive disorders in the United States. It's also common among military veterans. In this video, I'll give at least one reason why that might be. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help military veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service, so you can get the compensation you deserve. Now, I mentioned that I write Nexus letters mostly about orthopedic injuries, but I have been asked to write a number based on GERD, and I don't do a lot of medical conditions. I sort of let other medical professionals and preferably doctors and MDs do those, but I will take those on sometimes, especially for veterans that I have worked with previously for orthopedic injuries. But as it pertains to GERD, I get a lot of them that are claimed as secondary conditions to orthopedic injuries. And in this video, you'll understand why that is here in a second. But as I said, it's a chronic GI disorder. Again, you get a regurgitation of the gastric contents or the stomach contents into the esophagus and the burning that comes with that. One of the most commonly diagnosed disorders in adults in the United States. And there's a number of different causes, a number of different medical reasons for that. Basically, it's a disruption of the junction between the esophagus as it empties or as it goes into the stomach. And then now the esophagus is exposed to the acidity of the stomach juices, essentially. People typically complain of heartburn and regurgitation symptoms. You can get symptoms outside of the esophagus, such as chest pain. You can get dental erosions, a chronic cough, laryngitis, even asthma is thought to be somewhat related to it. There's no specific known cause to say this definitely is the underlying issue related to GERD, but there's a number of different risk factors. There's motor things, esophagus, where it's not flowing through the esophagus well. There's delayed gastric emptying. There can be anatomic factors like a hiatal hernia, things that cause an increase in intra-abdominal pressure, sometimes as the result of obesity. All those can be associated with an increased risk of developing GERD. Other factors that have been shown in studies independently associated with GERD are age over the age of 50 has been associated with GERD, tobacco use, excessive alcohol, pregnancy, a number of different medications like anticholinergic drugs, benzodiazepines, calcium channel blockers, antidepressants, albuterol, and what I see most often and why veterans reach out to me are anti-inflammatories. What we call non-steroidal anti-inflammatory drugs are NSAIDs. And so that's one of the things in terms of managing GERD is finding the underlying risk factors and then lifestyle modifications, medical treatments like antacids, sometimes even surgery. But as it pertains to NSAIDs, that's what I see most frequently is you have some sort of orthopedic injury, fracture, ligament injury, tendon injury, something like that. And again, because the treatment so often in active duty service members, if you go to sick call, is they just give you anti-inflammatory medications, or you don't report it and you just take anti-inflammatories on your own, ibuprofen, naproxen, a number of others, take them for a long period of time. That has been shown to be an independent risk factor for the development of GERD, gastroesophageal reflux disease. So you have this orthopedic injury that you take these medications for a long period of time, leads to these issues related to your stomach, related to your esophagus. You get diagnosed with gastroesophageal reflux disease, and then you claim that as a secondary condition to that orthopedic injury, whether it's your lower back and some lumbar spine degenerative condition, knee arthritis, hip arthritis, some chronic traumatic injury of the knee, the ankle, the foot, the lower back, the neck, all of that potentially can be related. Now, I've written an entire ebook about the disability claims process. If you're interested in learning more about it, you can get it completely free in the link under this video. It's called The 8 Most Common Reasons the VA Denies Service Connection for Disability Claims and How You Can Beat Them. Just click the link in the description below. You can get it completely for free. Make sure to subscribe to this channel, click the bell to be notified when I release a new video, and potentially if I start a live stream, I'm considering a live show specifically for veterans. Now, if you're interested in a Nexus letter for your injury or condition, click the link in the description below this video. You can learn more about working with me and working with my team. We do everything we can to make the process simple and to make it quick. And I really try hard to write a Nexus letter that gives you the best chance of success in your disability claim. Thanks for watching, and I look forward to helping you.